This is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today we're going to talk with Ruth, and she started care about a year ago after a fall. She'll tell you the story. She'll tell you what brought her into the office and what transpired following getting upper cervical chiropractic care. So Ruth, tell us your story.
Okay, so I came in about actually a year ago, and I had fallen in the shower, and the fall happened primarily on my head. My feet slipped out from underneath me, and my head took the whole fall. And when the next day I knew I had done some damage, and I had a lot of cognitive problems and putting words together and overwhelm and dizziness and boy, I don't know, it seemed like my whole brain was scrambled. So I was sharing with some friends that I was concerned about what was happening, and it seemed like the routine way of handling it was either medication or sleep, which, by the way, I did sleep probably in the first month a lot. Probably.
That's one of the best things you can do other than getting upper cervical care after a concussion.
Yeah, actually I really took all my, I'm a big multitasker. I work around events and a lot of people, and so I really took my life down to like really simplistic steps, and also just in the month, following the fall, and then I found you in that month, and so then we went into a care for probably two times a week for probably, I think I just phased out of it like probably 6 months. Yeah. And then in that time I got my speech a little clearer. It seems like I'm working on that. I sometimes get a little scrambled. And that's why I'm in today. I did another treatment, so I'm refining it. But I also have talked to people whose wife had a concussion too, and they're still out of work. And I returned to work pretty quickly. And one good thing that happened is that I no longer am troubleshooting like I used to and doing everyone's job. I'm just doing my own. So that was a good healing for me. And I have my sense of humor, that's real good. And it's just it's a great alternative to the Western medicine that is kind of still really don't know how to deal with concussions, and don't know how to and I think one of the best things about you is, and I think when I got recommended to you and I did research on you, you've been there. So it's been, I'm not talking to someone who hasn't been there.
Right.
And I'm, and this happened to me, and I just turned 70, so that's got to be deleted out. So, that along with aging was a pretty frightening, proposition that, am I going to remain this way?
Right.
So
if you had to put a percentage on it, if 10 was your normal self, what percentage back to your normal self are you? 50%, 75%?
I would say 70, because I think, and this could be not only the concussion, but the aging process that the concussion may be aggravated. So I'm still concerned about my short-term memory, and I'm still concerned about my speech a little bit. But my speech got a lot better, and we talked about it a little bit. And sometimes when I do a lot of multitasking, and it's complicated, and it's on the computer, like all these computer stuffs coming at me, I get a little overwhelmed. But nothing like I did before.
Yeah. So this story is great because we've done about 35 of these testimonies, and lots of them are overnight. a week or 2 or 3, they do better. Concussion is notorious. I mean, when you have a brain injury and a neck injury, it's a slow process. I've never had a concussion case that in a couple weeks they're better. And Ruth's story is kind of typical. It's a slow progression better, but we're glad you're 70%. We want to take you to 100%.
Yeah, right.
So thanks for your testimony.
70 might be low. Okay.
Thanks.
Thank you. Yeah.